All right. Thanks for joining, everyone. I think we have both our presenters and a good crowd. Really appreciate it. Sorry, the slideshow's been flickering up and down. I am not a WebEx master, so I'm filling in for Natalie today and fumbling my way through this. My name is Sarah Cariano. I am the Director of the Eligibility Policy and Outreach Division. And today for our community stakeholder meeting, we're just really excited to have you all here and really excited to have DMAS and DentaQuest staff here to talk about the DMAS dental benefit. So before we get started, I'd really love folks just in the chat to go ahead and put your name, your position in your organization, and if your outdoor space could have one really fun element, what would it be? And feel free to be creative there. So let's give it a few minutes for folks to put that in, and then we can go ahead and get going with the presentation. Awesome. Well, I'll let Justin and Altice introduce themselves if they want to come off mute and do that before their presentation. But recently saw a similar presentation in our member advisory committee meeting, and it was really, really thorough, really great. I learned a lot about our dental benefits, so I hope it's as educational for everyone else on the call today. And again, just thank you, Justin and Altice, for taking time out to do this. So if you want to go ahead and present yourselves, I can run the slides for you. Just let me know when you're ready for me to push them forward.
Okay, perfect. Sarah, can you hear me?
Yes, thank you.
Perfect. All right. So good morning. Good morning, everyone. Thank you all so much for giving us this opportunity to present this morning. Again, my name is Justin Gist. I'm the dental program manager for the Smiles for Children program. In my role as dental program manager, I often say I have the charge, but I also have the absolute privilege of managing and setting policy for Virginia's Medicaid dental program. And today I'm joined by my colleague, Altice Street, who is the outreach coordinator for DentaQuest. And before we get started, just to level set, DentaQuest is the department's dental benefits administrator. DentaQuest is the dental equivalent of the health plans or the MCOs. So we, DMAS, we set policy and they help to administer the dental benefit. So today, Altice and myself will give you a brief overview of our dental program. Next slide, please. All right, you can advance one more. All right, so the agenda for today. So Altice will begin with a brief overview of the Smiles for Children program. She'll then discuss what is covered under our program. And then I'll provide some information on utilization, specifically looking at our adult dental program. We'll then discuss the provider network before closing with outreach and community engagement activities, and then also some program enhancements that we put into place over the past year. Next slide, please. All right, I'll hand it over to Altice. Altice?
Excuse me. So good morning, everybody. As Justin said, my name is Altice Street, and I'm one of two outreach coordinators for the Smiles for Children program. So what is Smiles for Children? So I like to tell people that is the name. We do cover adults and children. And as Justin will speak on later on, we're going to go through a name change. So I like to also refer to it as the Medicaid dental benefit so people understand what we're talking about. But we cover the Medicaid Famous and Famous Plus individuals for their dental benefit from birth or when they get their teeth to, as long as they stay on Medicaid. There's no enrollment for this program. So we don't have a specific card, but we tell members that when you get one issued through the Department of Medical Assistive Services or DMAS, that is the card you want to use. It could either be the blue and white one or the one with the cardinal on it, and that's the card you would take to the dental practice, because that's the card they're going to use to look up the Medicaid ID number on. And as Justin has already spoken on, I work for DentaQuest, and we administer the dental benefit for Medicaid. Next slide, please. So going over the benefits, excuse me. Pardon me, I suffer from allergies and they decided to hit right now. So our benefits are broken up between under 21 and over 21. Under 21 is what we determine as our children. That's our definition of children. So up to the age of 20 on your screen are the benefits that are covered for those members. For anybody who's on the phone, that would include braces, fluoride treatment, sealants, cleaning, space maintainers, extractions, anesthesia or sedation, whichever term you use, crowns, root canals, x-rays, fillings, and then the dentist will have some oral health education. So if they're seeing certain things, they'll talk to the member about how to properly take care of their teeth, if they're grinding their teeth, how to do that, or different things like that. Now, before I move on, I do want to pause briefly and talk about the braces. If a member gets braces at the age of 20 and is going to roll over to our adult member benefit, those services will continue with them with the braces. So it's not you're at 21 and you don't get any other maintenance of those braces. That will continue. So there's no fear of that, because that has come up in some of the presentations that I've done, that people have a fear that if they get braces at the age of 20 and they roll to adult, because braces are not covered as adults, that the maintenance won't be covered. It is covered. They will be taken care of. So no fears on that one. For adults 21 and over, so that's what we classify as an adult, they have similar benefits. Basically, the only real difference is that adults can't get orthodontia or they can't get braces. So they will get the cleanings, the x-rays, the fillings, extractions, root canals, gum-related treatment. A big thing for a lot of members that I've spoken to is dentures. And then they'll also get the oral health education. For pregnant members, they have the same benefits depending on which age group they fall into. But they also, the biggest thing is they get the 12 months after the end of the pregnancy. So that is a big benefit. So they have us while they're pregnant, and then they have us 12 months after. And we really strongly try to get them in. One of the programs we do have is Smiling Storks, where we try to talk about the importance of going to the dentist while pregnant and the benefits for not just the mom, but also for the child. And the fact that any kind of bacteria or infection that the mom has could potentially cause issues during the pregnancy for the baby. So we want to make sure that they're being seen, they're using these benefits, and that if there are any problems or issues that are coming up that are being caused by oral health care, we are on top of that with the member. Next slide, please.
Right, so thanks, Altice. This is one of my favorite slides. It really does a great job summarizing why oral health is a crucial component of overall health. And Altice just spoke on the benefits that we cover. And this slide really embodies our program and why we chose to provide comprehensive services that make available each of the dental specialties. So many people know that oral diseases ranging from dental cavities to oral cancers cause pain and disability for millions of Americans. There's a growing body of evidence that has linked oral health, particularly gum disease, to several chronic diseases, including diabetes, heart disease, stroke. And in pregnant people, poor oral health has also been associated with premature births and low birth weight. There was also an NIH study that linked poor oral health to substance abuse and poor mental health as well. So we cannot begin to treat any person in this world, whether it be mental, physical, or emotional, without first addressing their oral health. And the comprehensiveness of our program, from our children to our pregnant members and our adults, helps with this. And the comprehensiveness is also in alignment with our mission here at DMAS. Next slide, please. So our mission here at DMAS is we take pride in improving the health and well-being of Virginians through access to high-quality healthcare coverage. And that access piece is very important. So the comprehensiveness of our benefit aids in improving oral health through access to comprehensive benefits. Next slide, please. So I'd like to transition briefly to our adult dental program and discuss our mantra, which will also drive home the reasoning behind our comprehensive benefits. So these are the 3 pillars that we use as our guide when we set policy and procedures specifically for our adult dental program. And we're set to celebrate the 3-year anniversary of that comprehensive benefits for adults on 7/1 of 2024. So taking a look at the first pillar, at the top in blue is prevention and education. So we realize that many of our adults may be unaware of the benefits of a healthy oral cavity and how a healthy mouth plays a role in a healthy life. Some of our members need to be reacquainted to proper oral care. Some of our members may have had regular cleanings as children, and because of a loss of benefits, need to be re-educated on the importance of sound oral health, which is why prevention and education is a pillar of our program. Number 2, we want to build around what is salvageable. So we want to provide restorations, i.e. fillings and crowns that support longevity. We also want to extract or remove what works against long-term success. Finally, periodontal maintenance, which is imperative for gingival or gum health and also whole body health. And I spoke about this earlier. There's a direct correlation between people with periodontal disease and people with cardiovascular disease, people with diabetes, people with chronic respiratory diseases. So maintaining good periodontal health will help maintain good overall health. So I've given you all a lot of information. We've talked about the benefits. We talked about our mantra for adult dental. Now I want to just switch gears a little bit and show you the benefit in action. Next slide, please. So since the commencement of the comprehensive adult dental benefit on July 1 of 2021, there have been over 560,000 adult members who have received a dental service of any kind. Over 270,000 adult members have received a dental cleaning. Over 240,000 adult members received a comprehensive exam. Over 750,000 adult members have received restorative services. And what's even better than this is, next slide, please. If you take a look at this graph, you will notice that our restorations are outpacing our extractions. So this means that we are saving teeth. Instead of only allowing for extractions, which was done pre-July 1 of 2021, we're now allowing our adult members to keep their teeth and restore those teeth with a composite-based tooth color filling. Next slide, please. All right, so now let's take a look at our provider participation. So currently there are 2,153 providers participating in the Smiles for Children program. This number represents approximately 28% of the Virginia's licensed dentists and 37% of the state's dentists that are actually practicing dentistry today. So I'll speak shortly to one of our goals with respect to provider participation in a slide here in a few. But now I'm going to hand it back over to Alti so she can discuss some of the community outreach engagements that she does throughout the Commonwealth. Next slide, please.
All right, so I will say myself and Tim, who is my counterpart, we have been very, very busy trying to get out in the community and let people know about DentaQuest and this benefit and what we're, what we're doing and trying to be everywhere. So we do have an outreach plan and we're working on our one for next year and expanding some of the places that we are, not just physically, but also virtually, because we know that, we can't be everywhere, but we can reach more members and community partners by doing virtual things. So we do have currently going on under our umbrella of community outreach is our new members welcome program. So any new member coming in will get a phone call, and that phone call will give them a brief survey that will ask them, where's your oral health at? Rate your oral health. And if they're rating their oral health poorly, they get a follow-up call where we try to connect them to a dentist. Also, if they are having any additional health issues that need to be discussed or connected to a provider that has some additional knowledge, then we pass them over to our case management. We also have Smiling Storks, which I briefly mentioned, which is our pregnancy program. We have a broken appointment program, which we work with our providers. So if a member breaks their appointment, they notify us so that we can speak to the member about the constant broken appointments and see what we can do to help with that. So for example, if they have broken appointment issues because of transportation issues, then we make sure we educate them about the benefit, the transportation benefit. Emergency dental redirect. So if a member goes to the emergency department for dental related issues, then that is we are notified of those cases also. So we will also have a conversation with the member about finding a dental home, which is what we refer to as a dentist that they will constantly go to. So finding a dental home and making sure they're basically set up for success so they don't have to use the emergency department. And with our chronic conditions, so if a member has diabetes, for example, then making sure they understand that their medications or different things like that could affect their oral health and what can be done to, once again, set them up for success. So all of our programs are to try to set our members up for success, but also if they are having any issues under any of those programs, they have someone there that they can ask questions to and to help them navigate the dental arena. So community engagement, like I said, we are out there from January to April. We've done over 145 events. We attend a variety of conferences. We do many presentations. We also work very closely with the MCOs, so the managed care organizations, and tons of community stakeholders. The questions we get all the time are, where are these events? These events are all across the Commonwealth of Virginia. I myself am just coming back from the Head Start conference. So we work with the Head Starts to make sure the families know about the benefit and how they can get connected to a dentist in their area if they're having any issues. But we do that through our trusted Head Start organizations because the families trust the Head Start organization, so we want them to trust us too, but they don't know us. So we partner with community stakeholders all the time. So I will say that if anyone is looking for Tim or myself to come out and partner with them or to provide any kind of dental oral health education, please reach out to us. I think at the end of our section is my email address. You can feel free to send me an email and I will, Tim and I can check our calendars. If it's in my territory, I'll be more than happy to come if I'm available. If Tim is available, then he would be more than happy to come. So basically, if you're looking at the map, if you look where Lynchburg is, Lynchburg to the right is me and Lynchburg to the left is Tim. There is some wavy area where whoever's available can come, but we're more than happy to come out and attend or sit on your councils or things like that, or provide you with education on dental. Next slide, please. All right, so one of the questions we get a lot is how to find a dentist. So there are actually several different ways to find a dentist. One of them you see on your screen is our wonderful website. So if you go to dentalquest.com, this website should come up as a screenshot of our new website. I will say if you went to the website, even 6 or 7 months ago, they've refreshed the website. They made it a little bit more user-friendly. So on your screen in the top right-hand corner is a button that says Find a Dentist. This button, once you click it, it will take you to a search box and it'll ask you a couple questions. It'll ask you for your location. So you can put in your address, you can put in your zip code, you could just put in your county. I myself always suggest to people, put in the address, put in the address that you're working with, because this way, when it pulls the list of dentists, it is finding the dentist the closest to the address and not just the center point of a county or the center point of a zip code. If you know the specialist that you're looking for, you can search by specialist. You can also search by cultural competencies. It's a long list that you can search by, and they're all on the left-hand side. So you can search by all of that. You can, when you finish your search, you can download the list of providers as a PDF. So if you're helping a member, you can just email them a PDF. So that is an option for you. Also, through our website, you can get our member handbook, which also has a list of providers in the back of it. I will say, as my disclaimer for the member handbook is created around the first of the month. So if providers, if new providers are added, or if providers are leave the network, just like everybody knows with any paper product, you know, as soon as you print it, it's out of date. But it is updated as of the first week of the month. So if you are a person who wants a document on your computer that you can easily get to, this is the document for you. Like I said, it is a PDF. So if you hit Control Find or Control F, you can search the PDF by locality. Pretty much the same information that you will find on our Find a Dentist tool will also be in the member handbook. But in the member handbook, you will have all the benefits that we discussed in the beginning, and it will also talk about, it'll give you all of the numbers. So if you forget everything Justin and I are talking about, if you get the member handbook, it will give you that kind of information. Also on this screen, you can also access our member service team by email. So if you're working with a member who has to work, but they can access their email throughout the day, that is an option for them. They will just email our member service team, and member services will help them find a provider. Next slide, please. All right. So I briefly talked about member services. Member services is one of our go-to places because they know a little bit about a lot of different things that go on at DentaQuest and about the plan. So on your screen is our member service information for those who are on the phone. Our member service number is 888-912-3456. We also have TTY TDD capabilities. So for our deaf and hard of hearing population, we do have that. Our member service team is also multilingual. So even if we don't have someone on staff, we do have language line. So we're trying to eliminate as many barriers as possible. Our member service team is open 8 to 6 p.m. And member services can help a member schedule an appointment. They can also do dental provider suggestions, so they can provide them a list of dentists. They can also assist with request for an appeal. So if a member gets denied a service, they can request an appeal right through member services or file a grievance. So if something happens at the dental office, they can give us a call at member services and they can start that process. Also, they can reach out for dental appointment emergencies. So if there's any kind of issue that happens, they can reach out to member services and get the process started there. All right. Oh, this is my slide. I'm sorry. So just some other resources. I've already discussed our website. So our website is the most up-to-date online function that we have because you can access our member handbook. Like I said, that's updated at the beginning of the month. And our Find a Dentist tool is on there also. Preventistry is our biggest thing. We want to prevent people from having tooth decay, from having to get extractions, like Justin said. We're doing our best to help people keep the teeth they have and not have to do any kind of pulling. So we are very big on preventistry, and we do have a preventistry newsletter that is out there. If you go to our website, you can also sign up through the website. It'll give you good oral health information. It'll talk to you about, it'll provide you with articles and things like that. So if you have a newsletter yourself that you want to put some dentistry things in, this will be a good place for you to go because you can pull some information there. And I also forgot, on our website are short articles also on different oral health topics. So anything from dentures to pregnancy and oral health, you have a lot of those articles there. We also have done and will continue to do a semi-annual member survey. We reach out to members and we just ask them, how are we doing? and they're able to provide us with feedback on that and also tell us what we can be doing better. And so we take that information as we move forward and we create new products to help the members or look at different ways to support them. We keep that in mind because each member is not a robot. Everybody needs a different way to be supported. So we want to make sure that we're supporting them in the way that they need it. But like I mentioned before, any member who is having an issue, I tell people all the time, we don't know what's going wrong because we're not there with them. So if there is an issue, I ask them wholeheartedly to give us a call at member services. Let us know what's going on. If it's a miscommunication, it's easily fixed. If it's something that we have to investigate, then that's what we're going to do because we want our members to feel supported. And I think that's it for me. So next slide.
Thanks, LT. So one of the things that I really place a premium on as a dental program manager for the department is listening. Listening to provider concerns about the program, listening to stakeholder concerns about the program, listening to member concerns about the program. Dr. Harrison, many of you know, is our dental clinical consultant. He and I travel to dental offices all over the Commonwealth. We want to hear the concerns with Virginia's oral health space. We sincerely believe that understanding needs help to create solutions. And I also understand that while it's important to recognize the progress that has been made, it's oftentimes more important to recognize what improvements and changes can be implemented to advance our program. So again, we've listened to concerns and took a few small steps in the direction of program improvement that I'll now discuss. So effective Jan 1 of 2024, we extended the age limitation for children receiving fluoride varnish from non-dental providers from through age 3 to through age 5. Now when a child goes to see their pediatrician, we cover fluoride varnish through the age of 5. So we understand the importance of fluoride for our children and want to ensure that our children are receiving this fluoride, even if they aren't being seen by a dentist. And improving this age will also help to improve our medical dental integration as well. Number 2, remove the current limitation on the number of times a dentist can build a behavioral management code when treating adults with disabilities. So over the past year, I've had the opportunity to learn more about our intellectually and developmentally challenged population. They face extreme challenges, especially when it comes to access to oral health care. So we want to make sure that our dentists are able to spend time with our IDD population that's necessary and personalized based on their situation. Number 3, provide payment for crowns for patients who receive root canal therapy prior to becoming a Medicaid beneficiary. This is one of the biggest concerns that I heard about our program when I assumed this role. So prior to January 1 of this year, we did not cover crowns if the root canal wasn't done as a part of our program. And for many members, they may have had commercial insurance prior to our program, or they may have paid out of pocket for their root canal. So it was important to cover the crown, even if the root canal wasn't done as a part of our program. And now we covered those instances. And then finally, provide reimbursement for pre-treatment evaluations performed by dentists treating patients requiring deep sedation or general anesthesia to mirror the CMS guidelines. And I'll also say as well that we are currently undergoing a code overhaul, a code rehaul, where we're looking to bring on new periodontic codes, new prosthodontic codes, and also addressing some of our general sedation codes with respect to our IDD members. So we're excited about those program enhancements. Next slide, please. All right, so network adequacy. I spoke about network adequacy a few slides prior. This is an area of our program that I'm really focusing on moving forward. And I think it's important for you all to know that. I think it's important to be very candid, to be very vulnerable when discussing network adequacy. So we have a little over 2,100 providers in the network. This is the highest number of providers that we've ever had in the Medicaid dental network. And despite this relatively high number, we still have providers in our network that see 0 Medicaid members a year, 0 members. So even though we have over 2,000 providers, my focus now is twofold. Number one, how do we get those 2,000 providers to robustly see members? And what does robustly look like? Robust for one provider may not be the same as robustness for another provider. We have some initiatives that we are discussing to help aid that. And number 2, how do we alleviate barriers and misconceptions about the program so new providers can join the network? Some of the challenges are fees. Some providers use fees as the reason why they won't join the network. Also, Southwest Virginia. So Southwest Virginia is a healthcare desert, not just for dental, but for healthcare in general. One of our initiatives that we discussed is attacking this issue as early as possible by partnering with the School of Dentistry and discussing the benefits of practicing in rural areas like Southwest Virginia. So more on the horizon, but we are attempting to attack the problem as early as possible by, again, joining forces with the School of Dentistry to discuss how we can meet with their D1s and D2s and D3s to discuss the benefits of practicing in rural areas. Next slide, please. Another way that we're increasing the network is through our peer-to-peer interaction via our Dental Champions Committee. So we know that one of the most impactful ways to attract new providers is through providers who are already actively participating. DentaQuest has already identified members within our program who robustly see members, and this committee allows the providers opportunities to network and recruit new providers into the program. The committee members also evaluate provider recruitment plans and review the program, identify administrative areas for improvement. Next slide, please. All right. Another program enhancement that was introduced as a result of the new dental contract was the Emergency Dental Redirect Program. Altice briefly mentioned this program earlier. And the thought process behind this program was that we know members who visit the ED or emergency department for non-urgent dental care are likely to return for the same issue. So we designed the program to connect the member to a dental provider to improve subsequent utilization patterns. So there are really three pillars to this program, and they are identify, outreach, and really maintenance. So identify members who visit the ED, contact those members to help schedule a follow-up appointment with a credentialed provider, and then ensure that members maintain a relationship with a dental home. So as Altice mentioned, DentaQuest currently receives emergency department utilization data from DMAS. Upon notification that a member has accessed an emergency department for a potentially preventable event, DentaQuest contacts the member, provides guidance on their dental benefits, and helps selecting a participating provider who can provide follow-up and subsequent care. And we're actually reviewing this program now, discussing how we can improve upon the program by potentially aligning with the Emergency Department Care Coordination Program, or EDCC. And that EDCC program is managed by Virginia Health Information, or VHI. And what this program does is it's a single statewide real-time communication and collaboration program among healthcare providers, not just dentists. So aligning with this program could potentially provide our Smiles for Children providers with real-time alerts if one of their dental home members visits ED. So more to come on this, but again, the current redirect program is live and being utilized now. Next slide, please. All right, the next program enhancement is around data. So we understand that data is extremely useful for stakeholders who want to promote oral health. We also understand that it's important to remain transparent with respect to network adequacy, to utilization, to fiscal information as well. So we are finalizing our oral health dashboard, which will be located on the DMAS Dental website. And again, this dashboard will include utilization data, total program provider count, an important aspect, provider participation. So who's actively seeing members, and then fiscal information as well. Next slide, please. All right, so another program that we brought on as a part of the new contract is the Case Management and Care Coordination Program. And again, Altice briefly mentioned this. One of the highlights of this program is the opportunity for DentaQuest to coordinate with the MCOs and also community-based organizations to really promote a full system health model to address our member health needs. So for members who are identified as needing case management or care coordination, they're stratified into a low risk, moderate risk, or a high risk. And then DentaQuest utilizes targeted programs and innovations based on the member's level of need. Case managers follow up. They make frequent contact with members in the case management program to address all the needs and the barriers to care. And then members are reassessed each year to track progress towards goals and potential for self-management, with the ultimate goal of really re-stratifying the member to a lower risk level. Happy to say that DentaQuest has established a direct referral path with each of the MCOs, which is currently being utilized. And we plan to release data on the results of that program in the near future. Next slide, please. All right, so social determinants of health, SDOH. Many of you know that social determinants of health are non-medical factors that influence health outcome, and they include economic stability, access to quality education, access to quality healthcare, where you live, what you're exposed to within your community. Why is this important? Why is this a program enhancement? It's important that we continue to help our providers understand how social determinants of health affect the member-provider relationship and experience. So to that end, Dr. Harrison, who I mentioned earlier, we travel around. We discuss social determinants of health and how providers must remain mindful of social determinants when treating all members especially members with disadvantaged socioeconomic backgrounds as well. So social determinants of health will always remain a program enhancement in our program. Next slide, please. One of the biggest misconceptions about our program, and rightfully so, is that we only cover children because of our name, Smiles for Children. So to better align with the agency's move to Cardinal Care Managed Care, and to also better represent the community in which we serve, our name will change from Smiles for Children to Cardinal Care Smiles. And this name change will go into effect in just a few weeks. So you all will be receiving information coming down the pipe on our name change as well. Next slide, please. All right, and here's some sneak peek rebranding material that will be released again with our new name and our new logo as well. Next slide, please. Before we transition to your comments and your thoughts, I also want to briefly mention that we have a 3% increase in our provider fees that will go into effect on July 1st of this year. So we've spent time discussing our program at length, and now we want to hear your comments and thoughts. What additional enhancements to the overall benefit for children and adults would you suggest we consider? How can we collaborate with the stakeholder community to increase access to equitable care? And really importantly, is there anything else we need to consider regarding our Medicaid program? So I'll open up the floor now for questions for Altice and myself. We left you all speechless. You all have no questions.
Such a wonderful presentation. I guess it covered everything. While I'm screen sharing, I can't see the chat. Does someone mind just checking the chat before we move on to make sure someone hadn't posted a question in there?
As well. Let's see. Melinda, I've got a question. I think Melinda has a question. Hi, Melinda. Good morning. How you doing?
I don't think they can unmute.
Melinda, do you mind placing your question in the chat?
Or Sonia, if you're able to, if someone, I don't know if people raise their hand, if you're able to take them off, unmute for us.
I think, well,
So we're,
says she's going to
I do see Jessica has a question in regards to Southwest Virginia. So we're actually participating in a forum in August, specifically on Southwest Virginia and some of the things that we're planning to do with respect to Southwest Virginia. Jessica, I don't know if I'll send you my email and I can send you an invitation to that forum where we'll address the lack of providers in that area, specifically looking at general anesthesia for adults, for our children, for our IDD population, and it'll be a panel discussion on where we'll discuss things to do to improve the program. Again, Jessica, you may not be able to unmute, but what I'll do is I'll send you my email address. I'll put it in the chat here, and then I'll also add you to that meeting if you can attend, because I think it'll be a very informative meeting. And we're meeting with a few community leaders in Southwest Virginia to discuss the program and how we can really target and hone in on the Southwest Virginia area. So I just sent my email to the chat. I don't know if, I hope you all.
And we will be sending out the presentation to everyone who registered, and you so graciously included your contact information in there. So if there are others from Southwest who want to attend as well, Justin, is it okay if they reach out?
Absolutely. And I think on the next slide, I have my email address, and then Altice also has her email address. Yep. And I see there's a question from Jennifer on a provider who's open on Friday. So Jennifer, if you could direct that question to Altice and Tim, who are the member outreach coordinators, they'll find you a provider who is open on Fridays that can see the family.
Awesome. And I think LT's, those member resources that you provided would also be a good place for that individual to start to help find providers open on certain days. Is that correct?
Correct. So the member handbook and the website, excuse me, both will tell you the hours of operations. So it'll tell you if they're open Monday through Friday or if they're closed on Thursday, but they'll also tell you if they have extended hours or even Saturday hours.
That's really great to know. Thank you.
And Jennifer, if you could send me an email as well. I saw the chat message. I'll add you to that form as well. It's in August, the end of August, I believe the 30th or the 31st. But if you send me an email, I'll add your name to the form.
Awesome. Well, thank you both again for your time. I know dental is always a big topic. I know I remember before we kind of added the adult dental benefit, it was something people are always asking for, and we just appreciate all the work you've done, Justin and Altice and DentaQuest on getting the benefit established, but then also just continuing to work with providers and community members to make sure it's what folks need and the folks who need it are getting to the services. So thank you both so much for all of that work, as well as coming today to present to this group. We really appreciate it. So kind of wrapping up, just our few last reminders that we include every month or every other month when we have these. So our next meeting will be August 15th. That'll go out in the newsletter and all the kind of standard ways we communicate and the registration links, and it'll focus on maternal and child health, and then Medicaid and school systems, which I know my kids go back to school in August. I think most schools do it these days, so pretty timely on that one. And we are kind of working on our back to school campaign that we do every year to make sure kids, as they're entering into school, if they do need health coverage and would qualify, have information on the Medicaid and FAMUS program. And just another reminder that we do have our member advisory committee and that we take applications year round. So if anyone is a member and would like to engage with DMAS in a more robust manner, please do submit an application and feel free to reach out to us if you have questions about what that looks like, what the commitment is, and those types of things. The Department of Medical Assistance website, which is on this page, also has a MAC member advisory committee page. It was recently moved, so if you have it bookmarked, just know that it's now under the page for all kind of committees and boards that DMAS hosts, and you'll still be able to find that page there and more information about the program there. And just a reminder that our Cover Virginia website is available in English, Spanish, and other languages to provide resources about the Medicaid program, Medicaid changes, Medicaid and FAMUS eligibility. And this is the community outreach and member engagement team. So our comment team just wants you to know that you can reach out to them with questions and needs as well, and how we can stay up to date. So thank you again so much, everyone, for joining us today. Please, we will send these slides out. They will be posted, but feel free to reach out with direct questions to any of those resources that have been listed today. And we hope that you just have a really lovely rest of your Thursday. Thanks, everyone.